Bismillahirrahmanirrahim. I am Mohammad Sadil Islam Sarkar again in front of you to discuss about the severity of COVID-19. The people who are at greater risk, the cluster of people who are in greater risk, who says people of all ages are in risk position to develop COVID-19. But now I will discuss who will be in the greater risk of developing severe illness. I mean, from infant to older age are susceptible to be infected by COVID-19. But who are in greater risk with suffering from COVID-19? I mean, who will suffer seriously and who will be fallen in severe conditions? I will try to find out the answer of these questions through this conversation. We know the people of all age have a possibility to be suffer with COVID-19. Novel coronavirus can affect all ages of people, including children to the older age. But there are some cluster. I mean, the people of older adults are very susceptible and very vulnerable due to this COVID-19. So far we know every day that death toll throughout the whole world is about 150,000 people. It's a normal death rate per day throughout the whole world, including different diseases. Among those, 2/3, I mean 1 lakh people every day are falling in death due to old age. So old age people above 65 years, they are very vulnerable, even they are attacked by COVID-19. So I will try to make it more clear. Rather than the people of older age are in risk, other than those group of people, the people who are under medical conditions, who are underlying medical care, are very vulnerable. And normally the people who have pre-existing medical conditions, who has pre-existing medical problems, I mean, who are under some treatments, those who are suffering from some chronic diseases are very vulnerable with COVID-19 rather than the other people. And normally we know and we have seen that COVID-19 is a new virus. We all know this. And this COVID-19 is caused by a new coronavirus, and normally doesn't require a special care to recover from this COVID-19, and it will show in maximum cases mild to moderate respiratory illness, and without having any medical care, without requiring any special treatment, people will recover from this COVID-19. But the people who are underlying medical conditions, who are underlying medical assistance, who has pre-existing medical problems, who are suffering from chronic diseases, are very vulnerable with COVID-19. And it is also said that the people with comorbidity, I mean comorbidity refers to one or more diseases along with COVID-19. I mean, he is suffering previously with some chronic diseases, for example cardiac disease, for example renal disease, for example Renal means kidney disease. For example, hepatic dysfunction, I mean liver disease, gastrointestinal disease, cancer, diabetes, asthma, HIV. Um, um, these are the comorbidity of a patient. If people are suffering from all those diseases, they will be very vulnerable. I will try to make it more clear one by one. For example, coronary artery disease. That is called cardiac disease or cardiovascular disease. Normally, we know in 2018 that I have said in my second video that on an average, each and every year, about 8.76 million people died with this cardiovascular disease. So, along with this cardiovascular disease, if you are suffering with COVID-19, so it's very vulnerable. Cardiovascular disease, including atherosclerosis, atheroma, myocardial infarction, ischemic heart disease, any kind of blockage. These are, ischemia, chest pain. This type of this all types of cardiovascular disease normally causes 8.76 million people per year. So with this situation, if you are suffering again with COVID-19, so it's very vulnerable. Simply it's very vulnerable. And it is said that about 13.2% death rate will be increased if you have cardiovascular disease. That means cardiovascular disease will increase 13.2% death rate simply if you are suffering from COVID-19. After this cardiovascular disease, there is another top leading causes throughout the whole world, that is called stroke. There are two different types of stroke. For example, ischemic stroke, hemorrhagic stroke, and totally about 6.24 million people are died every year due to this stroke. So simply with this stroke, if you are suffering with COVID-19, so death rate will increase again, and it will increase naturally, since stroke has a high death rate. So COVID-19 along with this stroke history will increase the death rate also. Rather than stroke and cardiovascular disease, lung disease, including acute respiratory disease, chronic respiratory disease, lung cancer, lower respiratory tract infection, upper respiratory tract infection, and other than this, lung cancer also. All those disease causes death, and worldwide it is 7.95 million per year. So simply it has a high death rate. So a patient with these lung diseases, and if he suffers with COVID-19, so simply death rate will increase. And it is said that chronic respiratory disease will increase 8% death rate rather than the normal death rate of the chronic respiratory disease. Chronic respiratory disease will increase when he is suffering with COVID-19, about 8% it will be increased. And diabetes is a worldwide chronic disease. Type 1 diabetes, type 2 diabetes, we know all of those two diseases regarding diabetes, and we know about 2 to 3 million people per year are falling in death due to diabetes. So a diabetic patient, if he is suffering from type 1 or type 2 diabetes, normally type 2 diabetes, uh, so with this diabetic condition, if he suffers with COVID-19, so simply it's very easy to say that that diabetic patient will be very vulnerable rather than the aged person or any other person having any ages. And it is said that this diabetes with COVID-19, due to diabetes, it will be increased up to 9.2% death rate due to diabetes. And in case of cancer, including all types of cancers, we know there are about 7 million people per year are falling in death due to normal cancer. So with this cancer situations, with this pre-existing cancer condition, if he or we are suffering with COVID-19, so it is also very vulnerable. And it is said that this cancer condition, when he is suffering with COVID-19 also, will increase about 7.6% death rate. I'm giving this death rate due to different chronic diseases to compare with the death rate of normal people having no medical care, having no special medical care, having no pre-existing medical condition. And it is said that normal people of all ages death rate is only 0.9%. Only 0.9%. So without those, if we say for other disease, for example, if you are suffering from asthma, so what will happen? It is said that about 250,000 people, I mean 0.25 million people are died due to asthma worldwide per year. And due to HIV AIDS, about 32 million people per year. So along with this asthma condition, along with this HIV, so she is more vulnerable than normal HIV death rate. Other than this, kidney disease, liver disease, we know about 5 to 10 million people per year are falling in death due to renal failure, due to renal disease, I mean due to kidney disease. So along with this kidney disease, if you are suffering with COVID-19, so you are so vulnerable and you will have a severe illness. Rather than this kidney disease, hepatic disease, I mean liver disease, it is said that only USA there are about 6 lakh, on an average 5 to 6 lakhs people are falling in death due to hepatic dysfunction, I mean liver cirrhosis, liver cancer, that is called the second largest disease of digestive system in USA, and 6 lakh people. So it's statistics of USA. So worldwide it is more than 6 lakh. So with this digestive dysfunction, with this liver dysfunction, if you are also suffering with COVID-19, so you will death rate will increase normally. Other than this, this hepatic dysfunction, other gastrointestinal disease called diarrhea, bloating, gas, abdominal pain, it is about 57 million people per year due to gastrointestinal disease worldwide each year. So with this pre-existing condition, with this chronic condition, if you are also suffering, if you are suffering with COVID-19, so vulnerability will increase with this chronic condition. So what I have said about different pre-existing condition, due to what you are facing some problems, you are facing severe illness, and you will be very vulnerable, and we will be very vulnerable with these pre-existing medical conditions, which I mentioned here. Cardiovascular disease. Cardiovascular disease will increase 13.2% death rate. Diabetes will increase 9.2% death rate. Chronic respiratory will increase 8.0% increased death rate. And if you have hypertension, that I didn't mention, if you have hypertension and if you are suffering with COVID-19, our death rate with hypertension will increase up to 8.4%. And what I mentioned about cancer, it will increase 7.6% increased death rate if you are suffering with COVID-19. And all age death rate, have no pre-existing medical conditions, who is not underlying medical assistance, the death rate is only 0.9%. So there is simply a question: why are these pre-existing conditions very serious for creating severe illness with COVID-19? Because if you have this disease, especially cardiovascular disease, diabetes, chronic respiratory disease, hypertension, cancer, we know that I have mentioned during my first video that there must have receptor, ACE2 receptor, which will help coronavirus to invade your lung cell. So with this comorbidity, cardiovascular, diabetes, chronic respiratory, hypertension, cancer, it will have higher concentration of ACE2 receptor. Not only this, during this pre-medical condition, pre-existing condition, ACE2 receptor will be in higher number, available number to cope with the to help coronavirus to invade or to penetrate in your lung cell. So ACE receptor, with this precondition of some comorbidity, will help coronavirus to cross or to enter into the lung cell easily. Other than this, due to especially for cardiovascular disease, diabetes, hypertension, and to some extent along with cancer also, these four types of comorbidity, four types of chronic disease will also have some insulin resistance. Those who are suffering with cardiovascular disease, diabetes, hypertension, and along with cancer are simply insulin resistant. So due to this insulin resistant, COVID-19 will be more powerful to act on those patients, and simply death rate will increase, and they will in higher risk for suffering severity of illness due to COVID-19. Anyway, along with those pre-existing medical conditions, we need to have serious care. We need to have ventilation, help of ventilator system, and we need to have ICU facilities. Otherwise, it's very risky to speed up the recovery of the symptoms of COVID-19, or to speed up the recovery of COVID-19 disease. Anyway, we can easily protect, because who advises people of all ages to protect themselves from this new coronavirus by following two normal ways, that is good hand hygiene and good respiratory hygiene. If we follow these two advised by WHO, we will be able to protect ourselves from the attack of novel coronavirus. So good news that Director General of WHO, Dr. Tedros, says no country alone will fight against this novel coronavirus. We all countries, we all are fighting. We all are united together to fight against this novel coronavirus. So we are not alone. We are one member of the world society, and we all are working together to prevent this pandemic, and inshallah we will be successful position in future, and human will withstand before this COVID-19, inshallah. No more today, more when we meet again.